Hi, good evening, everyone, and thank you for joining us for this drop-in clinic. I'm Jasmine Shah, Head of Advice and Support Services at the NPA, and just wanted to establish a few ground rules, please, before we can kick off, so we can all have a good experience this evening. So this is a drop-in session, so please feel free to come and go as you please. You're not obliged to stay for the whole thing, although if you want to, you're absolutely more than welcome to. That's absolutely fine as well. We're joined this evening by Sanjeev Panessa, NPA board member. So Sanjeev, would you like to introduce yourself, please?
I'm just joined the NPA board last year. I currently operate 5 community pharmacies in the Birmingham West Midlands area. Just got a good understanding of what's going on really, and be helpful to share more information on where we are with everything for this COVID claim.
Excellent. Thank you, Sanjeev. And we also have Cheryl Amin this evening from the NPA. Cheryl, do you want to just give a brief background as well?
Yeah, thank you, Jasmine. My name is Cheryl. I am a part of the pharmacy services team, advice and support pharmacist. I joined the NPA this year. I have a background in community pharmacy and I've been a COVID vaccinator as well.
Excellent. Thank you, Cheryl. And I've got to say, Cheryl's been working on the COVID cost claims project with us. And we also have Simon on the events team supporting us as always. So thank you. Simon will be moderating everything. We have the chat function open this evening because this is ultimately a meeting. So please do feel free to introduce yourselves and say hello to your peers through the chat function as well. Just to be aware, we will be adding some messages and links and information into the chat function as we go along on behalf of the NPA. Any discussions that you, our lovely members, have between yourselves in the chat function is obviously up to you, and it's not necessarily NPA endorsed, but happy for you guys to discuss amongst yourselves as well. It'd be lovely if as many people as possible can keep their cameras on. Definitely that improves engagement, but again, that's your choice. And please do join in the discussion. Please put your questions forward in the chat function. And without further ado, we will kick off. So our intention this evening is not for this to be a formal presentation or anything. We are here more really as to have a conversation, to highlight to you some of the questions that we are hearing from members through the advice line, what is concerning the most to our members, and how we can help address some of these questions for you. So before we come to what you want to ask us this evening, I think one of the things we would like to highlight this evening is the actual claim form itself. We've had a number of members asking that, how to fill in the claim form and how to access it, because certain rows in there are locked, which are examples. So if we can just quickly talk you through that, that will be something that we can get out of the way this evening quickly. So Cheryl, are you able to share your screen, if that's okay, please, with the official claim form?
Absolutely.
Thank you. So everyone, I'm assuming you have downloaded the COVID claim form, as you can see here, and you can see what the second tab looks like. This is the tab, the COVID claim data categories 1, 2, 3, which is causing the most questions coming our way. So what I would like to highlight, first of all, is that these 3 rows here, which Cheryl is just highlighting, rows 23, 24, and 25, these are just example rows. You don't need to do anything with them at all. These values are fictional. They're just there to demonstrate how to complete the form. You don't need to do anything. And indeed, you won't even be able to access these rows because they are locked effectively. So to complete the form, all you have to do is go on to row 26 onwards, the blank rows, and start filling them in by putting your ODS code for the pharmacy in column A. And then when you go to column B, an automatic drop-down menu arrow button comes up here, as Cheryl is demonstrating. You just simply select which of the 3 categories of claim you want to submit there. Yeah, click on it and it brings it up. Then go to column C, and there is where you put your figure in, the total amount that you want to claim for the additional staff costs as a category. You don't need to give a breakdown, it's your whole figure, whatever it is that you have worked out. And then in column D, that Cheryl is highlighting now, this is where you need to give a little bit of a narrative, like give information here as to what evidence you have reviewed and collated that you have compiled that has allowed you to come to that figure that you put in column C. So this could be invoices for locums, etc., or any other type of evidence that you have collated and kept ready in your evidence folder. And then you come to column E. Now, for the additional staff cost category, this is optional. So it's up to you whether you want to include a narrative in there or not. But you may want to. So for example, if you want to mention anything as to how you arrived at your amount claimed, or the type of evidence, or it's up to you what you put in there as a narrative is there to support the review of your claim. If you feel that you want to explain something, that's your opportunity to do so. However, be mindful that, Cheryl, can you go back to the column B, the claim category, and then that's it, yeah, and select IT and communication costs there, please, for me. Thank you. When you select that, and then you fill in your amount and your evidence type, column D, you have to put something in there for all three categories that is required. But for the IT and communication cost category, when you come to filling in column E here, that is mandatory. You must put in their information that is requested. There's an absolute requirement. So that needs to be completed before you submit your claim. So that is briefly how to, and also you need to fill in. So for each pharmacy, for each ODS code, you will complete 3 rows, 1 for each category. Just as been shown in the example where the ODS code is the same in column A, but then you have 1 row for the additional staff cost category, 1 for the COVID secure premises category, and a row for the IT and communication cost category. So you need to fill in 3 rows, 1 for each category per pharmacy. If you have more than 1 pharmacy in your pharmacy business, you can complete the claims on the same claim form, but again, you need to fill in 3 rows for each ODS code. So I'm going to stop there for a minute and see if anyone has any questions about that. And Sanjeev, also, if you want to come in here, please feel free to, because I know you've been completing this, haven't you? So.
Yeah, no, I think that would be the main thing, there can be easily a bit of confusion on that. Initially, we were almost breaking down each category. So for example, for one ODS code, we could have had additional staff costs, but broken that down, had that almost multiple times for the same ODS code. So I think, yeah, just to clarify what Jasmine has says, it is just a total accumulation for that single category. You don't need to break it down into individual kind of subcategories and explanations. So that's the important thing to remember there.
Yes, and that is the main thing. So it is 3 rows per ODS code, effectively, 1 row for each category. And that's the important thing. And you don't have to submit your evidence at this time with the claim form. You just have to highlight in column D or include in column D your narrative about what evidence you have collated that supports the claim amount that you're putting in column C. And what that means is that if your claim form, once you've submitted it, if it is called up for verification and you're contacted by NHS BSA to submit your evidence then to support your claim, then you have 5 working days from the day you receive the request to submit that evidence portfolio. So what we're hearing from members is some members are keeping that evidence portfolio as a paper file, for example. But a lot of members are actually creating a digitized portfolio where they're collating everything in a digital folder, something which can then be easily potentially zipped and emailed or just emailed across to NHS BSA when the call for evidence comes through, if your claim is one of the ones which is selected for verification. Everybody happy with that so far? Yep. Some nods would be helpful for me if I'm on the right track and when I'm addressing things. Excellent. Please do use the reaction buttons to tell me smiley faces or frowny faces if you're not happy with something. Do tell me, otherwise it's hard for me to gauge. Excellent. Thank you all. So that's one of the main things. Cheryl, could we go to the next tab, please, which is the category 4 tab for pharmacy closures, right? So here, this is a little bit different. Because for category 4, you don't need to put in a monetary value at all. All you have to do in there is put the F code in under column A, whichever pharmacy you're pertaining to. Then you just need to put in the dates when your pharmacy was closed for one of the permitted reasons, i.e. infection control or the self-isolation, and this is COVID related, what the total of number of days equates to, and the name of your NHS England regional team, and the reason for closure. Now, obviously, you may have had more than one period of closure, as they've shown here. So you have to put in each of the periods of closures individually and with the relevant F code next to it. Is everybody okay with that? But there's no monetary value attached here. You're simply putting in. Now, the really important thing is here is you can only put in closures here for pharmacies where you had, at the time of the closure, notified NHS England regional team that you are closing for a COVID-related reason. So for all of those notifications, your evidence is the emails or the correspondence that you have had with your NHS England regional team, and that is part of your evidence, okay? If you were closed for a COVID-related reason, but you did not notify NHS England regional team, then that cannot be included because that is excluded in here. Okay. Everybody happy with that at the moment? Excellent. Right. And Cheryl, we should go back to the declaration tab, please, just to make sure people, yeah. So this is the very first tab in the claim form. We should have started with that actually, and I just jumped straight to categories 1, 2, 3, because that's where all the questions are coming in from. So this is the first tab in the claim form. And as you can see, this is what your declaration is. So you are effectively reading all of this, declaring, and then you can see there's a yellow highlighted section in row 35. You need to tick that. Sure, there's any chance you can magnify that a little bit? Sort of make it bigger, like 100% or something. No, if you go to the bottom right-hand corner, you might be able to increase that. Yeah, that's it. Yeah, perfect. And then scroll up. Oh, might be too much. There you go. So you need to tick that box there in row 35 if you agree to all of the above, which I'm assuming you have to if you're deciding the declaration. And then Cheryl, if you scroll down a little bit more, please. Thank you. And then you need to put your details here, name, surname, contact, email address, and then make sure you read the declaration in row 43, which says in signing this, you're confirming that you as a contract holder, etc. So you're accepting responsibility for submitting this entire claim. So that's where we are. Okay, and let's just have a look at the chat function now. Right, so, okay, so the claim form which is available through the NHS BSA website is in the form of an Excel spreadsheet. You need to download it to your laptop, computer, whatever device you're using. You might have to click the enable editing button at the top for you to complete the form if it is in a protected form. Otherwise, complete it in the Excel spreadsheet itself. Save it again on your device, the laptop or desktop, whatever you're using. And then you submit the completed Excel spreadsheet claim form itself to NHS BSA at the address that is given. So let's bring that up. Cheryl, could we bring up the NHS BSA? Actually, Sanjeev, thank you. He's put that in the chat box. It's nhsbsa.covidclaims@nhs.net. Yeah. So that's the email address. And remember, this is not an online form that you need to complete. This is an Excel spreadsheet form that you need to complete and then email the completed Excel spreadsheet form to that particular email address. So what is included in here for the pharmacy closure category, which is category 4, is it's where this was notified closures for infection control purposes where all staff had to self-isolate, or notified closures for infection control purposes for pharmacies in health centers. That is the reason for the pharmacy closure for infection control purposes is category 4. It does not appear to include closures for other business reasons, which is excluded, as you can see in the third column there. Now, other business reason might very well be, as you mentioned, about reduced staffing available. Sanjeev, did you have any thoughts on that?
For reduced staffing available?
Yes. So the question we have in the chat function is that if the pharmacy was closed for some of the hours or operating at reduced hours due to staff shortages, would that fall into the pharmacy closure claim, which is, in the category 4? That's how I'm understanding that question.
Yeah, from my understanding of Shiv's question, it's a case of some contractors didn't close permanently for a full period of, like, for a full day. They may have they requested the local area team to reduce their opening hours. So instead of, for example, opening, if it was a 100-hour pharmacy, that they may have reduced hours during that COVID period. I don't think I would consider that a closure for reduced hours. I think they're quite specific there, that a closure is, for those infection purposes where you've had to literally close your pharmacy and is not operating at all.
And you're right, Sanjay, because when we look at the exclusions criteria, what is excluded, it states clearly that any closures which are not for the purpose of infection control are excluded. So I think that is a very specific category where it's closure for infection control purposes specifically.